Hello, this is Dr. Sravani Behara, Specialist Psychiatrist at OPENMINDS Psychiatry, Counselling and Neuroscience Centre. Today, October 10th, has been celebrated as World Mental Health Day every year, and the very objective to celebrate this day is to raise mental health awareness around the world and to reduce the stigma surrounding it. This year's theme is Mental Health in an Unequal World. This highlights on how access to mental health services remains unequal in the world. As per World Federation for Mental Health, between 75 to 95% of the people in lower and middle income countries do not have access to mental health services. This could be because of huge differences with respect to financial resources, where there is an economic burden, people cannot afford accessing mental health, because of the professional resources, where the availability of the psychiatric services, psychology, the therapy, the mental health teams may not be present equally in all parts of the world, because of the stigma, discrimination, education, literacy, not knowing what mental health is, cultural differences, age. For suppose people think that children, they do not have mental health issues, but in reality they do. The gender, some people think that men, they're supposed to be strong, they're not supposed to be depressed or something like that. However, when we compare the statistics, the number of completed suicides for men is more significant compared to women. And especially with this pandemic, it has taken a huge significant impact on mental health of people around the world. People have been devastated by death of their beloved ones, by going through the trauma of hospitalizations, not knowing how the disease progresses, not knowing what the treatments are. The economic crisis, continuing job struggles, job insecurities, financial struggles, social isolation, loneliness, physical distancing resulting, all this triggered huge psychological issues. This global rupture highlighted the stark inequalities with regards to mental health conditions. And we all should work towards a world where there is no stigma and no discrimination towards mental health, and where physical health, just as like that, we need to talk openly and discuss about mental health. For suppose, I can give an example. For suppose, we all usually state reasons of physical illness as one of the reasons for the leave. However, do we anytime consider putting our mental health? For suppose we are mentally exhausted, we wanted a break, we are in a burnt out position, that we wanted to rejuvenate and regenerate mental health. No, do we even consider it? No, it's because of the stigma prevailing. We wanted a world where people are not labeled, they're not judged, they're not discriminated by what they have. We wanted a society where mental health has been supported. We wanted a world where educational schools, workplaces and communities know what mental health is and know how to support it. Mental health in an equal world is a world worth fighting for. And so let's join our hands and make this possible. That is mental health for all, and let's make it a reality. Thank you, one and all.